Hello, everyone. Thank you for joining today's briefing, Health Policy Roundup, Federal Policy Analysis and Priorities. This briefing is the first in our Roundup series, which will reflect upon health policy priorities and initiatives from 2021 and provide some insights as we move into the new year. We will have these weekly Roundup webinars that will outline some major health policy milestones and informed predictions for 2022. So please join us the next couple of Fridays. I'm Catherine Martucci, Director of Policy and Programs at the Alliance for Health Policy. For those who are not familiar with us, welcome. We are a nonpartisan resource for the policy community dedicated to advancing knowledge and understanding of health policy issues. I'm going to go over a couple of housekeeping notes before we dive into the conversation. Want to thank today's sponsor or funder, the Commonwealth Fund. Thank you so much for your partnership. For those in the audience, you can join today's conversation on Twitter using the hashtag AllHealthLive and join our community at All Health Policy, as well as on Facebook and LinkedIn. And today's event is a roundtable discussion with some wonderful panelists that will help us reflect upon the various initiatives that might come up this year. So we have some guiding questions that will lead our conversation through a couple of different themes, but please be submitting your own questions to the panelists at any point. We will be collecting those and giving them to the moderator throughout the broadcast. In order to do that, you should see a dashboard on the right side of your web browser that has a speech bubble icon with a question mark. You can use that speech bubble icon to submit questions, and you can also use that to chat about any technical issues that you might be experiencing. All right, so now I'm excited to introduce our moderator for today's event, Rachana Pradhan. Rachana is a national correspondent for Kaiser Health News and reports on a broad array of national health policy decisions and their effect on everyday Americans. Prior to her time at Kaiser, Rachana was at Politico for 5 years, where she covered healthcare policy and politics on national and state levels. So no one better to moderate this discussion. So Rachana, I will turn it over to you.
Thank you so much, and happy Friday to all of our attendees and our panelists. I really appreciate you all inviting me to participate in this today. So we have a great panel. I'm just going to get started with some introductions. First, joining us today, we have Jennifer Alton. She is president of Pathway Policy Group, where she works at the intersection of government, external stakeholders, and media. Prior to her time at Pathway, she worked in the biotechnology industry, and also has experience on Capitol Hill working for the U.S. Senate Health, Education, Labor, and Pensions Committee, which of course is very important for our conversation today. So next we have Yvette Fontenot. She's a partner at Avenue Solutions, and Yvette has nearly 25 years of federal healthcare experience, has held senior positions on Capitol Hill, as well as in the White House and at HHS. Next up, joining us today, we have Katie Keith. She is the director of the Health Policy and Law Initiative at the O'Neill Institute for National and Global Health Law at Georgetown University Law Center. I can't believe I got through that in one breath, but anyway, Katie is also teaches a course on the Affordable Care Act, and she has been a very trusted, reliable expert for me and countless other health journalists. So welcome, Katie. Next up, we have Sydney Mann. She is a partner at Manat, where she uses more than 30 years of experience in federal and state health policy for her clients to develop and implement strategies around health reform, Medicaid, the Children's Health Insurance Program, and delivery system reform. Cindy previously was Deputy Administrator at the Centers for Medicare and Medicaid Services, where she led the Obama administration's efforts on Medicaid, CHIP, and the Basic Health Program. And last but certainly not least, of course, we have Rodney Whitlock. He is Vice President at McDermott Plus Consulting. Rodney previously was Health Policy Director for U.S. Representative Charlie Norwood and was Health Policy Advisor for U.S. Senator Chuck Grassley while he was Chair of the Senate Finance Committee. So thank you all so much for joining us today. As a reminder, I am going to start today's conversation, but please submit your own questions to the panel at any point using the question mark button on the attendee interface. So to open up our question today, let's set the table. Yvette, I wonder if you could start with Build Back Better is on everyone's mind after its relatively unceremonious end not too long ago, or temporary end maybe. I'm wondering if you could just give us an update on this very large piece of legislation, and in particular, what would be the biggest pieces as it relates to healthcare, and is there a path forward on them?
Yeah, sure. Happy to do it. And thank you to the Alliance for having me. You all continue to be an invaluable resource in the congressional debate. So the Build Back Better, just as to orient folks and take a step back, was a bill that was first proposed by the president, passed by the House before the holidays at about 1.7 trillion, I think in the end, price tag, and was happily moving its way to the Senate. And then, as you referenced just before the break, Senator Manchin announced that he could not support the legislation as drafted. And just to reorient, the reason that's important is because the Build Back Better proposal is moving through a process called reconciliation, which requires only 50 votes to pass in the Senate, where most things require 60, and the Democrats in the Senate only have 50 votes, and so they need every Democrat plus the vice president's vote to break the vote and get that passed. So they have the reconciliation instruction, which allows them to do that, and they were moving forward. I think where we are now is that the negotiations will continue with Senator Manchin to see if we can get him to a place where he is comfortable in terms of supporting the legislation. There's a lot of technical work that needs to go on behind the scenes by staff to get it to a place where it's ready to bring it to the Senate floor, including work with the Congressional Budget Office to score it and make sure it doesn't increase the deficit, which is a requirement of reconciliation, conversations with the parliamentarian who will decide whether each and every provision in the bill is meets the rules of reconciliation, and and the drafting that has to happen with Legislative Council. All of that technical work was being done, is being done, continues to be done. And so really this is about a negotiation to see if they can get all 50 senators, and Senator Manchin in particular, in a place where he is comfortable. The current position of the Senate is they are on voting rights, the Voting Rights Act, and they will continue to be until it looks like probably throughout next week, when they will not be in recess, but they will be here considering the Voting Rights Act. And I think the hope is that they will be able to turn back to Build Back Better once they complete the consideration of the Voting Rights Act. One thing to point out is from a procedural perspective is that and I know we'll talk about this more later, but that the government funding bill that currently funds the government runs out February 18th. So we are running up against that, and obviously that will have to be dealt with, you know, simultaneously or in some way at that time while they consider Build Back Better. So that may also help dictate the Senate schedule. In terms of the substance of the bill itself, you know, there are any number of provisions in this bill. I will focus on the healthcare provisions, but I think there are a lot of arguments for why you should pass this. I think the biggest argument is that it will reduce racial disparities in this country, and that is a focus of this administration, as it should be, as well as Congress at large. It does contain a number of provisions, as I said, including paid leave and the child tax credit and housing vouchers and climate change provisions, et cetera. In terms of the healthcare provisions, it includes an enhancement and expansion of the premium tax credits that are available under the Affordable Care Act for people to buy coverage. It includes a provision that would fill what we call the Medicaid gap, which are the people who live in states that have not yet expanded Medicaid, and allows them to get coverage on the exchange, which currently they have absolutely no avenue for coverage. It includes about $150 billion in spending on home and community-based services under the Medicaid program. It includes the addition of a hearing benefit to the Medicare fee-for-service package, and it includes a number of provisions that would impact drug pricing and bring down drug pricing, including a $35 cap on insulin for people with coverage. I will just say, and then I will stop talking, that the healthcare provisions that were included in the bill seem to be in pretty good shape. As these conversations with Senator Manchin proceed, they do not seem to be the most controversial provisions in the bill that he has highlighted. They do not currently, as House passed, extend permanently or through the 10-year window, and he has expressed a concern about that formulation. But in terms of the substance of them, they do not seem to be at the forefront of what he's objecting to. This could all change, but at the moment, they seem to be in pretty good shape in terms of if and when the bill moves forward, they seem likely to be included.
So I just wonder if we could piggyback on that real quick and ask a politics question, which is, of all of those health provisions that you mentioned, and of course there are many competing interests even within that those buckets, what do you think provides the biggest political liability for Democrats if they do not get it done going into the 22 midterms?
I mean, I will just tell you what the polling says that I have seen, which is that generally speaking, the healthcare provisions pull the most popular of any of the provisions in the bill. It's a true kitchen table issue. And of those provisions, the provisions that impact drug pricing pull the highest in that bucket of healthcare provisions.
I wonder if we could get maybe I'd like Rodney to weigh in on that also.
Uh-oh, this could be problematic. Okay. I mean, I think obviously drug prices is an easy one. I mean, who's in favor of higher drug prices? I think the challenge, I think the APTCs, the ACA tax credits are a very interesting one because of, first of all, they're currently in place. They reduce the cost of healthcare. The question is whether or not anybody knows and cares. Certainly the enrollment numbers suggest that. So I think it's worth noting that when you give somebody something and take that away, it's a little bit more challenging than just promising something and not delivering it. So that's probably the one I watch for most closely.
Right, always difficult to take something away once you have given it to people. That is very true, as we've seen time and time again, even not too long ago, actually, with the with the attempt to repeal the ACA back in 2017, which I know it seems like an eternity ago, but it was not that long ago. So, well, why don't we pivot just slightly before we get more into looking ahead to 2022? Why don't we think about what actually did happen last year? 2022 hasn't quite registered in my mind yet, but 2021 was last year technically. And I just wonder if, Katie, if you could get into this, what do you think was the most important piece of health legislation that passed in 2021?
I mean, in 2021, I think from my perspective, I think it's undoubtedly the American Rescue Plan. I mean, for the issues that I work on and care about, there was so many things, I think that has been the springboard for a lot of the proposals in Build Back Better, certainly extending the marketplace subsidies that were included there. I think I would add on Roddy's political point, if they don't extend those subsidies, they're up at the end of the year. Folks who are enrolled would get those higher premiums on November 1st of this year, which also coincides right before the midterm election. So if you want to take it political, I think maybe not having premium shock for the at least 14.2 million people that have enrolled in coverage thus far is probably pretty important there too. But even the rescue plan included some Medicaid enhancements, several very important ones that states are either opting into. It included some additional money for states to take up and fill the coverage gap that Yvette mentioned. They are by and large not doing that, which I think is why Congress is being more aggressive in the Build Back Better Act. So I think there's just a lot of, from my sort of coverage perspective, precursor policies in the American Rescue Plan that Congress is now working on building on. But I would love to hear others' thoughts too, if it's not the rescue plan, and why.
I would jump in and say I would agree the rescue plan is number one on the hit parade in terms of the impact in 2021. and ongoing, and many of the provisions that that Katie mentioned. Would also note that there was back to Yvette's reference to the importance of promoting equity as the extension of the postpartum coverage for pregnant women. It's temporary in ARPA, and again, like the marketplace subsidies, would be made permanent if BBB is enacted, at least as voted on in the House. There's also a really important investment in home and community-based services, which is a very important issue, and a really strong public support for it. And every state picked up the option to get some enhanced match, but the enhanced match and new funding can't supplant other funding. So it really requires that you expand and strengthen your workforce and your services and your eligibility. And that again is led to, or is connected to an even broader provision in the Build Back Better Act.
Mm-hmm. Well, I wonder if we actually have an audience member actually with a question already. Yvette mentioned this. We are running up against another, our CR running out very soon. They ask, since the short-term spending measure expires in about a month, do you think there will be another short-term CR? Will there be a budget with increases for healthcare, or will Congress act to keep funding at current levels for the rest of the fiscal year?
Yeah, I mean, my sense on that is that, well, they are working towards getting an omnibus done so that they don't have to do another CR. My sense is they're going to need at least one more CR, and that'll take them to probably April, and that I'm not sure they'll be able to get over the finish line with an omnibus before February 18th. I do think that and it's been in the press this morning that the White House is contemplating another COVID relief package that would have to be bipartisan and ride with the CR. There's also, talk of the possibility of another bipartisan healthcare package, small package that would ride with the CR along the lines of some telehealth waiver flexibilities and some other technical changes they need to make. And the CR is February 18th, but there are a number of other expiring provisions like the Medicare sequester relief, and the physician payment update relief that expires end of the April and then end of the year. So there are a number of deadlines that are up and coming, but I think that it's likely they may get some of those things done with a CR as opposed to an omnibus, and then have to come back and do, either an additional CR into next year or further budget bill in April would be my guess.
Mm-hmm.
I'll jump in just quickly enough to say, the cool thing about it being an appropriator is spending money the way you want to, and that CRs don't allow you to do your job. With the National Defense Authorization Act passing just before Congress blew town at the end of last year, it now really ups the pressure on the appropriators to get a deal done. And really, it's what other intervening factors play into it that actually complicate getting their jobs done, like the rollout of a potential supplemental, and how does that complicate conversations? I think that's what's the big thing to watch.
Well, and I mean, so going into this year, Jennifer, I'd love for you to weigh in on this. I mean, we just talked about there might be another COVID relief package. Is 2022 going to be another year in which healthcare legislation is very much dominated by this pandemic, or are there other themes or areas that you think are likely to be pursued in Congress?
Yeah, well, certainly pandemic preparedness is everywhere. For the kind of the first time, as somebody who's worked in this field for a really long time, it will be interesting to me to see whether there is a shift from COVID response to looking towards the future of our readiness for future pandemics or other health security threats. And looking at the American Rescue Plan, it was interesting. We didn't mention all of the multi-billions of dollars that have been provided to that side of the response, and looking at $6 billion going into medical countermeasures for vaccines, therapeutics, diagnostics, but that's all for the immediate response. And now we have an opportunity to look ahead and say, what do we need to do to be better prepared to make sure that this kind of health crisis never happens again? So I think there's definitely an opportunity for that. And the Senate Health Committee, everyone's kind of waiting with bated breath to see what comes out of Senator Burr and Senator Murray's process. So I think there's great enthusiasm for something getting done there in the year ahead.
I wonder if, I'm just piggybacking on that. I mean, one of the things I've been interested in my pandemic coverage is there's always these perennial calls that we need more domestic manufacturing to make. Right now, the latest thing is COVID tests. I mean, it's very, very difficult right now. Our supplies are very, very constrained. And part of that is because people say, especially with the global supply chain crisis, we have to rely on overseas manufacturing for so many things. Do you think is there an actual genuine appetite? Has the needle shifted at all as far as whether that could be a part of this, or is it basically going to fall by the wayside again?
I think there's genuine interest in domestic manufacturing of medical supplies, whether it's vaccines, therapeutics, PPE, other things, and there's been major investments made already, but that's really been focused on the immediate COVID response. So, but I definitely think there's concern about our overseas reliance for key products that we need for future health security threats. And I would anticipate that would be part of what comes out of the Senate Health Committee process.
Yvette, how about you? Is there anything else, any big themes you see being very heavily debated this coming year, whether it's pandemic or not?
Well, I mean, I do think as it relates to Congress, there do seem to be a handful of bipartisan themes that they're looking into. There's telehealth, as I mentioned, but also mental health and substance use disorder and the ongoing opioid epidemic. There is the need to reauthorize the FDA user fees as those expire, I believe, at the end of September. And there's a lot of interest in that. And then I do think the pandemic preparedness theme will continue, and there is the bipartisan process the Health Committee is running to develop legislation there. So there does seem to be, some interest in the healthcare space, particularly on issues that align somehow or have been exacerbated or highlighted more by this pandemic. And I think, racial equity and health equity as an overarching area of priority that I would say is bipartisan as well. Maybe not the solutions exactly, but the issue itself and how this pandemic has highlighted that is going to be part of the ongoing conversation for sure.
So what I'd like Rodney maybe to kick off with this. So what needs to be reauthorized in 2022? So we talked about there are some, I know sequester relief is one thing, user fees are a big one with the FDA. So, and what would the impact be of not reauthorizing these programs that are must do this year?
So the user fee acts are this fascinating little triumvirate between the committees of jurisdiction, the manufacturers, and the FDA, where they all come together to reach an agreement to say, this is what we need to move forward. And then they tell anybody who wants to be engaged to get the hell away from our work. We've reached an agreement, go away. I only speak of that from experience, having watched this process occur every 5 years for a number of times, where it really is tight. Now, I think what's going to be fascinating this year is what's going to happen on drug pricing in BBB. Because if it doesn't actually go through, then it becomes a very complicated conversation, frankly, especially for Democrats, to explain to folks how it is. We're coming up with this agreement with pharmaceutical manufacturers, which is to their advantage, but we sort of skipped the drug pricing part of the conversation. That's going to be fascinating to watch. On the other side, the Cures Act way back in 2017, 16, 17, that's an interesting one because it does have a few, not, A1 above the fold type programs that will hit a reauthorization because it's been 5 years. So they will be out there, which may motivate a lot of things in Cures 2.0. How much that moves forward remains to be seen. But those are the ones, it's not a long, extensive list of things that need to occur like back in the old days of SGRs and things like that. It's much more of a limited list, particularly watching for how does OOFA play out politically?
Yeah, well, SGR, there's an acronym I haven't thought about in a long time. I guess, fortunately for me, well, it's interesting what you say on user fees. I'd like maybe Yvette and Jennifer to weigh in on this. These things, user fee acts are very much under the radar to the average person. They happen every 5 years, as you said, and people out in the world who are not in Washington or in the industry or involved in FDA work do not pay attention to these things. And you're suggesting that it actually might pose a political problem, that this level of policy granularity would actually, perhaps cause issues for Democrats if they don't do drug pricing legislation simultaneously. Of course, the FDA has nothing to do with prices, right? So how do those two relate?
Usually it's the concerns about actually having to lay people off at the FDA if you don't get it done on time that drives, getting it actually done. And I agree, it's not something that the public generally looks very closely at. But I agree with Rodney that just having major piece of legislation get passed, even though it's not something that the public normally looks at, but it is in the drug regulatory sphere, that not doing something on drug pricing would kind of look odd to the average person, I would imagine.
So I want to shift a bit. We had some big Supreme Court news this week on the Biden administration's COVID vaccine mandates. Of course, the test or get vaccinated mandate for large employers, for businesses, was not upheld. But then, of course, the more narrow one, still significant for healthcare workers, was upheld by the court. Katie, would you be able to speak on major healthcare court cases from 2021 and the impact, especially of that vaccine mandate ruling that we just received?
Yeah, just a nice, easy request there, Rachna. Thanks so much. Believe it or not, right, the Affordable Care Act was upheld by the Supreme Court in 2021. I think we forget that, right? There was that major California versus Texas was just this past summer. And so you had this overlay of American Rescue Plan, like injecting a lot more federal funds, and you had record high enrollment. And then at the same time, the case was before the court and it was upheld 7-2, and now we've all forgotten about it, and it's over. But I always feel the need to just go back. That was less than a year ago that we were all sort of tied up in knots about will they or won't they for the third time with the Supreme Court and the Affordable Care Act. So that was a huge major case. This, as we think about this year, I think a lot of folks have definitely paid attention to, that was just yesterday that we got the rulings that Rachna was talking about on the vaccine or test mandates from OSHA and CMS. Those will still kind of proceed, right? This question on the merits, this question was about whether they would be put on hold for now. And so we're actually going to continue to probably see litigation and rulings coming out of that. But for now, things are on hold on the workplace mandate, but healthcare workers, that will go into effect. So there's even more to come on that, I guess, is the warning to folks here. So if you want to keep following that issue, you should be. Some of the other big cases that I'm certainly watching this term, we don't have anything blockbuster on the Affordable Care Act itself. Certainly many folks are paying attention to the Dobbs case, which is the abortion case. They did their ruling on the Texas SB 8 case. Flummoxing to me that they allowed that law to go into effect, but here we are, and we'll continue to see that one work its way through the court system. There's also a couple, these are wonky, weedy issues on Medicare policy, but they could have some really big impacts. So there's one called Empire Health Foundation. There's another called the AHA versus Becerra, and I'm not going to go into the details, but they're about sort of complicated statutory interpretation questions and did HHS do right by the statute in interpreting the Medicare DISH formula and in making payment cuts to 340B hospitals. And there's billions of dollars at stake. Or B, I think there's some deeper, broader questions about how much flexibility federal agencies have in issuing rules and interpreting their own statutes. And Cindy could speak to this as well, but it's sort of the same issue as we just saw in these vaccine mandate cases. And so with a much more conservative Supreme Court, I think it's sort of this long-standing project, if you will, I think you have justices that are very skeptical of the administrative state and of how much of a long leash to give agencies. And you could sort of see that really cutting back on OSHA, saying you don't have the authority to do this, you've gone too far. CMS, they found it, but CMS did have, somewhat stronger, more more explicit, more specific authority, and they sort of let that go forward. They're going to weigh in again on this, on these big Medicare cases that I'm talking about, which we'll start to see come out this spring and summer. And it's something that I'm sure the Biden administration is thinking a lot about, of is it going to be much more challenging to issue rules and do interpretations? I think that matters a lot more, especially if the midterms flip and you maybe don't have a Congress as willing to do things, and you're relying on your executive agents, executive authority more than anything else. So I think there's a lot more to come from the court. It's not necessarily things that would affect day-to-day life, but for real people, but could be signaling a major shift in how we do sort of executive policy, and would welcome comments on that, or friendly corrections from others as well.
Well, I think that's actually what I was thinking. We have a question for the audience for Cindy, which is, we haven't talked about the Biden administration's regulatory priorities a lot, but what they've clearly, 2021, they've issued a lot of rulemaking on the No Surprises Act, so, which of course just went into effect. Cindy, could you talk about what do you see as being the Biden administration's biggest priorities as far as healthcare and, regulations or other executive actions?
So first of all, I totally agree with Katie's takeaway from some of the judicial actions, which is that it could really shift the balance in terms of what the executive can do or can't do through regulations, or the processes they need to take. Can they do it through sub-regulatory guidance? Do they always have to proceed by formal regulations? So I think that is an important area to look out for beyond the specifics of the particular cases. If BBB passes, I think looking ahead, the administration is going to be all about implementation of BBB, because it's so many provisions that will need guidance, and certainly on the health pieces, that's true, guidance as well as actual implementation. For example, we talked about the fallback provision that would provide coverage for people in the states that have not expanded Medicaid. That would be a lift for the administration to move forward. First year is pretty much as is, but then some additions and complementary provisions need to be adopted in outer years. But the administration has made it really clear that it's got priorities. They've issued lots of different blogs and policy and thought pieces around expanding access, driving innovation, coverage, and equity being really high priorities. So I think what we can expect is to see some new activity and additional activity around social drivers of health and equity. Those aren't necessarily equatable, but there's certainly overlap. The administration recently approved California's approach to social drivers of health. And the interesting thing about the California approach that CMS adopted is that it doesn't require special waivers for the most part. And it really can be done under standard managed care authority. So it really does open up some possibilities for not just California, but for other states to really be moving in this direction, which I think many are doing, and more so since COVID highlighted the importance of that intersection. They've also signaled the access review, looking at regulations in the Medicaid program, both for fee-for-service and for managed care, to ensure that coverage actually equates to receipt of care, and that equity principles are really observed in how we think about providing access and monitoring access. There's going to be real issues, new issues around that long-standing debate, new issues raised by the workforce shortages, new issues raised by how do we think about telehealth and how does that fit into thinking about what standards of access should be. There's going to be some real thought around justice-involved initiatives. The BBB has a provision that would require states to provide Medicaid coverage for 30 days pre-release. There's the already, though, provision that requires CMS to issue guidance on how states can move in that direction through waivers. And a number of states have waivers pending or are planning to submit waivers to get into healthcare in jails, and really with an idea to not to stabilize people's care and improve people's care, and then to do some warm handoffs on reentry. One thing I just want to flag, which I think is going to be an enormous issue, regardless of what passes in legislation, both for the administration and then for states, is the unwinding of the continuous coverage provision. So as part of one of the very early COVID relief packages, states were offered additional federal matching payments for their Medicaid program. And one of the conditions was, because we are in a pandemic, that people who are enrolled in the Medicaid program should stay enrolled in the Medicaid program through the duration of the public health emergency. And so on the Medicaid side, we have seen a growth of the Medicaid program pretty significantly. We're probably around at least 84 million people, up at least 10, 12 million people since the pandemic started. The data lags a little bit. And everybody in the program, nearly everybody in the program is going to have to be redetermined and have their eligibility considered. And that's a big undertaking at any point in time, particularly now with staff shortages at the state level, and also because people have moved and relocated. So there's just a lot of risk points, and there's going to be a lot of attention to this, as there should be, given the focus on both coverage and equity.
Mm-hmm. Well, I wonder if one thing I thought of actually related to that, a different kind of perhaps great unwinding, but we're only a year into the Biden administration. And of course, at the start of an administration, many times the priorities as to what gets looked at is unwinding what the prior administration did. So that certainly happened at the start of the Trump administration, and it did happen at the start of the Biden administration also. But is there anything left, big ticket health items, where people thought, they're probably really going to open this up again and undo what are those things, if so?
Yeah, you're absolutely right. And I kind of, I'll turn it to Katie in a minute, and I kind of, it's sort of like the Supreme Court's decision on the ACA. I kind of skipped over that. Oh yes, that was this year too, right? Every administration looks at what the last administration did and sees what they want to do to change that, and often take quick actions to do that. This administration did that, certainly in the gag rule, for example, around Title X rules. And, significantly, it moved forward pretty quickly in with respect to work requirement waivers, making it clear right from the jump that, consistent with court actions and court rulings, that the Biden administration determined it didn't, those waivers didn't further the objectives of the Medicaid program, and rescinded them, which is a big step to take in an administration in terms of changing waiver policy. But it's a policy that had the potential of really undermining the coverage goals of this administration, and as I noted, was certainly contested. So I think there are some additional things that are still remaining. The Biden administration recently notified, just in the last couple of weeks, some states that it will no longer approve and maintain waivers that have allowed premiums for people in the Medicaid program, and it took that action in light of general evidence of premiums dampening participation, but also in light of what the Congress did to provide for zero premiums for people in the marketplace at somewhat higher income levels than what might have been imposed in Medicaid. So I think they're both looking at the parity issues and just generally access issues. So there's still a few things that probably remain to be addressed, but they are working their way through that list. Katie, did you want to add to that?
Katie, feel free. You want to jump in.
Thanks. Not to be immodest, I have a recent analysis up with the Commonwealth Fund. Actually, I had looked at sort of public-facing recommendations to the transition team. I think directly to Washington, and sort of looked at what the policies were where there was consensus among a whole bunch of healthcare stakeholders. From that, we identified 13 sort of high priority federal administrative actions. They're, as both of you suggested, of sort of straight up reversals of Trump era policies. So far, the Biden administration has accomplished 7 of those 13. And so, some of it is, funding navigators, which of course they did, or, opening the special enrollment period, which they did for 6 months, and it was bolstered by the rescue plan subsidies. Some of it, I say that because some of it's been easier to do than others. And then I am a dork, like, and I think I'm in good company on this, but I spent a lot of time digging through the fall unified agenda, which sort of lists out their priorities for the next year. It's not binding, they don't have to do it, but it is the sort of good sense of what direction they want to go in, and it sort of prepares agencies. So even from that, there were another 3 of those 13 policies that I had on this list. Fixing the family glitch, which would extend marketplace subsidies to about 5 million people who are still kind of left out in the cold, even under the rescue plan. More than half are children. So very, I think, important policy there, and something that, you know, was created by the Obama administration, or is an Obama era issue. So the family glitch, limiting short-term limited duration insurance. So the, you know, the so-called junk plans, but kind of tamping down on those, and then reversing the Section 1557 non-discrimination rule. There's some links to the court, as Cindy was suggesting, for many of these policies, but they've suggested that to the courts even that they'll have that proposed rule out no later than April of 2022. So those are all pretty big lifts. That's all in addition to the No Surprises Act that you mentioned, Rachna, which we haven't really talked about, but we could, because that's taken up an incredible amount of work, and I'm tracking a lot of litigation now challenging the rules that were issued over the past year. But you know, some numbers to put to that progress that I think we all are sort of feeling there, for what that's worth.
Yeah, real quick before we pivot, I do want to, oh yeah, Jennifer, go ahead, please.
Thank you so much. I just wanted to add one other thing. It's not really a regulatory initiative by the Trump or the Biden administration, but just in August, it doesn't feel like that long ago, they put out what was called the American Pandemic Preparedness Plan. And this was an initiative where they proposed $65 billion over 7 to 10 years to get the country in a much better position to respond to and really prevent future pandemics. So it includes transforming medical defenses, ensuring situational awareness, strengthening public health systems, kind of managing the mission through a mission control function, and building core capabilities. So I think that's one thing I wanted to make sure people were aware of, and hopefully will be incorporated. Some of that initial funding was incorporated into the Build Back Better Act. Whether that proceeds or not is obviously an open question for everyone, but if not, then will they incorporate funding for implementing that plan in the 23 budget request and beyond is an open question.
Absolutely. I do want to shift back. I'll shift back to the Hill in a minute, but we have an audience question actually related to surprise billing. So I'm going to throw that to Katie, which is so notable developments in 2022. I imagine there are going to be quite a lot. So this audience question is, do you expect notable developments or attention on surprise billing and price transparency, which we saw a good amount on last year?
Yes. I do. I think that's
so. Please elaborate.
Yes. So no, I mean, I think for anyone who maybe thinks that surprise billing is done and over, that is not what we are doing on health policy these days, because now the issue is before the court. So I mentioned this just briefly. There's 5 lawsuits challenging the Biden administration's interpretation. They're somewhat narrow challenges focused on, you know, the big issue of how employers and insurers would pay out-of-network providers through an independent dispute resolution process. It is kind of the heart of the matter that was being heavily debated on the Hill between the stakeholders. The Biden administration issued what I think is quite a strong rule, and it's now being challenged in court. And so there's one case in Texas, there's 2 in DC, there's 1 in Illinois, and there's 1 in Georgia. I think most folks are familiar with the case brought by the American Medical Association, the American Hospital Association. So you have some heavy hitters bringing these challenges, and I think that's just going to kind of continue to influence at least that part of it. Consumers are fully protected in terms of out-of-pocket costs, and I think we need to keep a close eye on how the actual implementation goes. I think there's, you know, I think the Biden administration and state insurance commissioners and others, consumer groups, are doing some of the education to make sure folks understand their rights and that they should be protected and all of that. But I think there's still going to be questions about enforcement and how all of this goes, particularly probably in the first 6 months of the year. It'll be something good to keep a close eye on, and then we'll kind of be waiting and watching for the courts. I don't have as much of a sense on transparency, so I would, you know, other folks can sort of speak to that. They're moving forward. They keep kind of, the timelines have been shifted around, but it does not seem to me like they're kind of backing away from a lot of those initiatives. But again, would welcome other thoughts.
I think the biggest question that I think of when it comes to price transparency, and there's been research that's been published on this, is that compliance is very uneven. You know, whether it's actually usable information, you know, for even researchers or other people, let alone the average person trying to weigh how much things cost. And so I just wonder, is there any, you know, I guess maybe we can, Yvette or Jennifer, I don't know if you want to weigh in on this, if there's any teeth that can be put behind, you know, actually insurance compliance among you know, institutions that are required to in theory do this.
Yeah, and I think this was sort of moving along two tracks. There was a hospital transparency requirement, and there was a plan transparency requirement. I think in terms of the hospital transparency requirement, this is an area I think where the Biden administration has actually doubled down on what the Trump administration put into place, which is to say that they are tracking compliance, and they have recently issued, you know, the series of CMPs that will, or the civil monetary penalties that will be assessed against hospitals that are not in compliance with that transparency requirement. The plan transparency requirement was, I think, delayed a little bit while or enforcement was delayed while they figure out whether there is some redundancy between what was required as part of the congressionally passed transparency requirements in the Consolidated Appropriations Act, and then the transparency requirements that were put into reg by the Trump administration. But I don't think those are far behind. And to your point, I do think the question is the continued tracking of compliance here, but also both on the hospital and the payer side, how to make this information usable and helpful to consumers. I don't think anybody opposes, I mean, the stakeholders don't love transparency, but I don't think anybody opposes the idea of transparency. It's sort of hard to be against it. I think it's really just a function of figuring out how to make this information helpful for consumers. How do you actually make it, you know, functional so that it can help impact the way that they purchase healthcare? And I'm not sure that any of these regs necessarily lead to that outcome quite yet.
Right. I'm going to take up one other audience question before I talk about things related to the Hill again, including reconciliation. So we got it. This is a great question. Workforce shortages, especially in the care of older adults, that is, of course, been acutely. People realize how big of a problem it is, especially you know, with the pandemic, and certainly now everyone's getting sick, it seems like, because of the Omicron variant, and so any sort of workforce challenges are being exacerbated. So can any of you share any possible action to alleviate this problem, and how do you expect workforce strain and shortages to impact any sort of policy action in 2022, whether it's in the Biden administration or in Congress?
I can jump in on some of it. Certainly, the Build Back Better provision around investment into home and community-based services was very much focused on the workforce. And if you think about what it means to provide home and community-based care, it is really all about workforce. And I think COVID laid bare how fragile that system is, how fragile the system is in nursing homes and in home and community-based services. And also, I think, shed a little bit of light on who are the people that deliver this care. I mean, they are largely women. They are often women of color. They're caring for kids. COVID had hit them as well as their patients, and they're often working 2 or 3 jobs. Their pay is often quite low, and often lack leave benefits, sick leave, which becomes even a bigger issue, of course, during a pandemic. So I think the question is right on in terms of really targeting an area that needs a lot of attention. You know, I was just talking to a health system, a large health system in a rural area today, and their workforce shortage right now because of Omicron is just extraordinary. And of course, they're getting backups from the nursing homes because the nursing homes aren't taking any more individuals. So people are getting backed up in the hospital. And so, you know, it's a very acute problem, but it's also a longer term problem as to how do we really kind of right the focus on where we spend our money in healthcare and really think about the workforce as the central element that it really is.
It's got to be
One other
directed into that. Go ahead, Jen.
Go ahead, Rod. Oh, I was just going to say one other workforce issue I wanted to highlight is the public health workforce at the state and local level that has just been totally decimated and undercut in many regards during this pandemic too. And so that's another area that is ripe for action and support at the federal level. Go ahead, Rhonda.
Right. I'll put in a shameless plug for some of my colleagues at Kaiser Health News, and the AP had a year-long investigation called Underfunded, Under Threat that looked at our significantly depleted public health workforce and why it certainly matters right now, but also in the future, and increasingly how people who are working in that line of work are subject to threats, forced firings, and retiring because it's so difficult. So I think it's required reading, but I'm biased. So, but if anyone is curious, you look for any of that on khn.org. So, yeah, I think it's very, but it's very, very important at this time. And I think if anything, it's even harder now to work in public health than it was, certainly 2 years ago. So I do wonder, but I don't know if there's public health workforce. I mean, Jen, do you think that there's an appetite? Can that be bolstered federally in any way right now? A lot of this, of course, is happening, because of state and county level activity that, people here don't, it's not necessarily picked up upon.
Yeah, well, certainly from a funding standpoint, there's a lot that the federal government can do, and that was a major part of the Build Back Better public health and pandemic preparedness provisions. There was $7 billion to CDC for supporting state and local public health infrastructure, and that's primarily workforce challenges. So, but yeah, you're right. I mean, the regulations and laws are really state level. So they have to be addressed there, but certainly resources can be made available from the federal government.
For sure. Well, I wonder, we've been talking about Build Back Better, but I am wondering if, and maybe I'll kick this to Rodney, reconciliation. Do we think that we could see another round of reconciliation in Congress this year, and what would the priorities be if so?
Well, this current one's gone so swimmingly, of course another one would. Listen, that the existing instruction is allowed to stay in place through the end of the fiscal year. So they can work with the existing one through September 30. Mm-hmm. They can create a secondary one, which would be for the following fiscal year. What that means is that in as much as Democrats feel like they can find some ways to come together to move legislation, they have alternatives and structural ways to get it done. Their problem is this whole unanimity thing that they continue to struggle with. Absent that, the tools aren't the issue. It's the actual votes that are the issue.
Who'd have thought voting matters when it comes, especially in a 50-50 Senate, right? So, I know it's shocking. So, well, does anyone else have any thoughts on, well, can reconciliation, current instructions are good for a little while longer, but is it basically Build Back Better or bust, or can anything else potentially move under those instructions?
Well, I don't know about anything else, but I do think, as you think about Build Back Better and the importance and significance of that piece of legislation and the concept, I think that is still driving the White House and the caucus, which is that failure is not an option in terms of getting something done in reconciliation, if only because of the what is it, 3 million people stuck in those 12 states, 60% of whom are people of color, according to the Center for Budget and Policy Priorities, that have no other avenue for coverage, and the 8 million people who have enrolled through healthcare.gov and will see their premiums double if they do not extend those premium subsidies. I think that what will likely pass using reconciliation will not be the size and scope of what we saw in the House, nor will it be close to the size and scope of what we were all hoping for last year, but they will pass something. I still believe that they will pass something through reconciliation this year using that process that is a scaled back yet significant investment in working families and what they need, going into the rest of this public health emergency, which, by the way, the administration just renewed because it was expiring 2 days from now. Tomorrow, sorry. They just renewed for another 90 days, and I believe will renew for 90 days after that, if not till the end of this year.
Right. I wanted to ask you all that, right? They just came in under the wire. I think no one thought it was really going to lapse, but realistically speaking, how long are we talking about, this public health emergency being extended? Of course, this isn't just about, as hopefully I think our audience probably knows, but as long as this is in effect, it has, of course, tremendous consequences for the availability of our COVID vaccines and tests and so many things that have been authorized under emergency use. And so how long are we thinking? Is this going to go through the end of 2022, potentially into 2023?
Yeah, I mean, as you point out, and I think people understand, but it is worth reiterating, the public health emergency triggers any number of things. It goes way beyond the rhetorical value of us all acknowledging that we are in a public health emergency, to things like vaccine approval and testing and flexibilities to providers to use telehealth and waivers of certain requirements like the 3-day admissions from nursing homes, et cetera. So it reverberates way past just the national psyche to a lot of tools that it gives the federal government to use to help people through this emergency. I think a lot of how long it lasts depends on, is there another variant behind us? When does this one peak? I mean, there's so many unknowns at this point. And I have no doubt that, whatever politics should bring, this administration will extend it as long as they need to have the tools that they need to address this pandemic. So my guess is it goes, at least through the end of this year. But, there's sort of betting odds on that question.
Is there
just as
any
a reminder too, just that one of the early acts from the Biden administration was to promise the governors that there would be at least a 60-day notice if when it comes to an end, because of all the issues that Yvette identified. There's just a tremendous amount of authorities that health providers rely on, that states rely on, hospitals rely on, and so forth, that are triggered by the public health emergency. So to just shut it off without ample notice to stakeholders would really create a lot of chaos. So they've committed to that, and I think are respectful of the need for good notice in advance.
But just real quickly, just the political point that Yvette made and even Cindy made there, don't rule out as utterly ridiculous at least January 20th, 2025.
Oh, I mean, it seems quite likely at this point, like you said, I mean, because there are so many things that are tied to this declaration. I mean, I just wonder is there any, it seems like, again, it's important, but these things relatively, people pay attention to it and they sign it, it goes for another 90 days. Is there any pressure, or do you think there would be any pressure from anyone to not extend it? And if so, where does that come from? Anyone?
The payers who, and particularly the utilization that these flexibilities and how it creates changes, that will there be pushback if there is really arguably, well, we're no longer in a public health emergency. I mean, the reason I made my somewhat inflammatory comment there was that, if you end up in a situation where that the only way to extend certain activities that have occurred under the public health emergency is through legislative action, it's the inability to reach that agreement that creates the pressures that cause that. That's where I'm coming from with that. I mean, again, greatest example is telehealth. I mean, we've worked in this space for a long time. All of us have. None of the stuff that's being done through the public health emergency would we ever have gotten through legislatively. Not even close. We'd gotten laughed at for, hey, can we? No. Going to CBO with that? No, you may not go. No. We had gotten hard-nosed for years. Now it's being done regularly. I haven't seen my doctor in person in almost 24 months. Oh, I mean, imagine that. Okay, so it's those transitions and the, resetting the clock that is going to cause the pressure there.
Mm-hmm. Go ahead.
Just one point on that, I'm sorry, and Cindy raised this earlier, and I don't know that this equates to pressure to end the public health emergency, but just to put it on the table that this requirement for continuous eligibility for the Medicaid program is tied to the increase in the federal matching rate for Medicaid, which is tied to the public health emergency. And for some governors, I think that requirement has for their state budgets and for them politically has sort of overtaken the value of the additional Medicaid funding, at least in perception. And so I think all things being equal, the value that they get from a public health emergency being in place for all of their stakeholders and for various other reasons probably outweighs that, but it's worth just keeping in mind that does weigh heavily on the minds of some governors, I think.
I think that's true, though I think it does tend to be maybe more rhetorical, but when they're actually looking at the numbers, the 6.2% increase has been pretty significant, but it definitely is a very long time for that provision to continue. Obviously, also a very long time for a public health emergency to still be ravaging the nation and people needing coverage.
Right, I'm sure, as we've seen, of course, before, it's been it may not be politically tenable to have that many people on the program, but if there's any usually threat or risk that money goes away, well, privately they will say something, and sometimes even publicly will say something completely different, even in these states where it's not exactly popular to expand enrollment in safety net programs.
Can I just say another word about the continuous coverage, which is that generally, if you look at income dynamics over time, and certainly if you look at it during the period of the pandemic, to the extent that the data are available, it's pretty likely that the people that are on the Medicaid program are either continuing to be eligible for Medicaid, or if not, potentially the marketplace. So we're not talking about it's not very realistic to think that people who go into the Medicaid program are eligible for the Medicaid program have suddenly gotten tons of income and a job that brings them affordable private health insurance through the workplace. So it's really what continuous coverage has done in many respects is to just eliminate the churn that happens where eligible people lose coverage and sometimes go back. And there's a lot of states that have actually recognized the health value of eliminating churn and being able to really be able to provide continuous care and address people's health needs in a way that doesn't get interrupted by occasional loss of coverage. So it's important to recognize that these are largely people who are probably eligible for Medicaid or for the marketplace. And which is why people are concerned about how the unwinding happens, right? To make sure that we're really identifying eligible people as opposed to having people lose coverage because of process.
Are there concrete measures that you think the Biden administration could take to ensure that you minimize any coverage losses from that eventual unwinding?
I think there's lots of concrete measures that they can take, and they've really been prioritizing it and put out a lot of materials and are continuing to put out different flexibilities, best practices, and I think they're looking very closely at different authorities that they might be able to offer states some options to smooth the transition or to make sure that the determinations of eligibility are done in a way that don't lead to procedural denials. So I think we've seen already a fair amount of guidance come out from them, but I think we will see a lot more. And they're also planning to do some very one-on-one technical assistance and support with states.
Mm-hmm. That's great. Well, I'm going to kick another audience question here. We're going back to Build Back Better. the topic that keeps on giving. So Jennifer, I wonder, I would love for you to take this. If that entire package can't or won't move fairly soon, at what point do lawmakers break out the healthcare provisions into separate legislation, especially because, as you all referenced earlier, many of the health provisions are broadly very popular?
Sure, I can start and then welcome other folks' input. I mean, I think certainly from the kind of public health and pandemic preparedness side of things, which is where I kind of focus my time, there already is another vehicle for some of that to move potentially through the Senate Health Committee process. So, the pieces that are not going to be able to be attached to that are significant new resources, because the Health Committee process is an authorizing process by appropriations. So, but yeah, I mean, I think there are other things that will potentially move, and things can be attached to that as well. But then it comes down to whether there can be agreement on a broader over 50 member vote threshold. So.
Right, and I think therein lies the problem and why we're in a reconciliation moment, right? Maybe some advances on some of the public health investments, but certainly filling that Medicaid coverage gap that Yvette mentioned for the 12 states that have an expanded Medicaid coverage, keeping the Affordable Care Act, ARPA provisions going. Those are not necessarily bipartisan priorities.
Just drug pricing is an interesting one for us to watch, in this sense that to get to 218 and 50 in the House and Senate, if it is under reconciliation, can drug pricing go with the ACA tax credits, or does drug pricing need something called SALT? And I personally don't know SALT from pepper or anything, but I hear SALT's important to a lot of Democratic members, particularly those who are in the Northeast. So when we start looking at that, it's not clear that, to me, the healthcare provisions could be pulled out and ride separately, or are they really tied to other provisions as part of global deals? That's the part I don't get.
Well, how about, I guess related to legislation, we haven't talked really about bipartisan the Cures 2.0, and also proposed the ARPA-H program and funding in NIH. I wonder if, Jennifer, if you want to take a stab at that. That was an audience question too, I'm sorry.
Sure. Yeah. I mean, I think ARPA-H is definitely something where there's some bipartisan support for it. Senator Blunt has made it clear that he supports it. And there's been pieces of legislation that have been introduced already to authorize that, and then funding included for ARPA-H in a couple of different bills. So I think that's very possible. What was the other piece?
Oh, I'm sorry. I think it was NIH funding in NIH is what this question.
Yeah, and I think that goes kind of hand in glove with ARPA-H, because that would most likely be within the NIH as well. But definitely that's a bipartisan priority and has been for many years, and we see big billion-dollar increases for NIH in most years. So I think that could happen as well.
Right. I mean, just for political, NIH funding, there's very large bipartisan support for maintaining or increasing funding for the NIH, right, in Congress. And I just wonder, compared to the CDC, let's say, right, I do think CDC funding seems to be a bit more politically fraught, especially recently, because, people have had many bones to pick with the CDC in the pandemic response. And so I wonder if you think, does that also help any sort of odds with NIH funding?
I think they're pretty distinct, and historically, I would say CDC is not, a partisan. There's not been a big partisan divide there, but I think there is more now post or in the midst of this pandemic, and people seeing some, things that they're not happy with, and unclear guidance, and behaviors that make folks question whether the resources have been spent wisely. So it is an area where there is more of a partisan divide than there has been in the past.
There's another great audience question here about Medicare, which we have not talked about a bit, but Yvette or Rodney, I wonder, could you address, the question is, any concerns in Congress regarding Medicare trust fund solvency? Could there be any upcoming provider or MA payment reductions to help extend solvency of the trust fund?
I mean, Medicare solvency is always a concern. I think, and Rodney or somebody correct me if I'm wrong, I think the latest trustees report had solvency through 2024, which is not nearly critical enough for Congress to actually deal with it. So I think, you know, of course, we will have a conversation as we get closer to that insolvency date, but it does seem like at this point, the concerns about, you know, providers actually being able to provide care and, you know, hospitals being overwhelmed, et cetera, sort of outweighs the concern about the Medicare solvency in terms of where the funding is going. I do think, though, and I defer to Rodney about this, but if the 2022 election goes the way conventional wisdom, I think, expects it to go, I expect we will be in a much larger, longer, deeper conversation about deficits and entitlement reform and Medicare solvency than we are now.
The last president to go into his first midterm election with his party in control of both houses of Congress and come out of said election with his party in control of both houses of Congress was James Earl Carter. That's the trend that Biden is fighting this term. And if the election goes as it has, you know, for all those years since Carter, I can tell you right now, the theme of this presentation next year will be Medicare solvency.
And lots of oversight, I imagine, also, which they've already made clear. I guess that's more of a House thing, though. So, I would be remiss in not talking about politics. I did work about, you know, at Politico for 5 years, as was mentioned at the top of this call. So, let me take. Let's see. Who do I want to kick this question to? I think maybe I'll go to Katie. Tell us what's top of mind for voters going into the midterm elections, and how is that going to impact what actually gets done on this year, healthcare or otherwise. As you know, right now we're in a debate about voting rights, so I'm gonna steer clear of that, but maybe we stick to the health stuff.
I'm the least qualified person to answer this question, but sure, why not? I think it's got to be the pandemic response. I mean, as much as I sort of even care about all these other issues, I think, you know, the testing in school, and maybe if we're channeling sort of the Virginia election and the results there as kind of the harbinger of kind of how is life still feeling as disrupted as it is probably the metric that I would guess most people would use. But I would add, you know, some of these other strains, like if we don't have these, you know, marketplace subsidies and other things, there are things that could be more disruptive. But heading in, that would be my guess as a law professor type with no real bearing at all. But you're welcome.
I had to keep things interesting, you know. I figured I have to mix it up a little bit. So who else wants to weigh in on that?
Yeah, I mean, I think, Katie, despite you self-deprecating, you hit the nail on the head, which is that the pandemic is, you know, going to be front and center. But I also think, you know, the issues of inflation and economic issues related to that. I do think healthcare always resonates in polling and in elections, and rises to the top as the kitchen table issue. You know, I think there are the issues of election disruption and voting rights, you know, play well, and I think going into an election will weigh on people as well. So you know, I think it's going to be an interesting election fraught with issues, as always.
And affordability is always a big issue for people around healthcare, right? And it goes back to, I think, both what Yvette and Katie are saying. It's very much sort of the bread and butter issues and the kitchen table issues, you know, which is, are my kids getting to go to school? Do I have daycare? You know, can I go to the job? But, you know, so all of that COVID related issues, but also can I afford my health care? Do I know that can I find a home health aide to take care of my, my aging mother? And, what happens when I go get a prescription filled on my drugs? So those may not be categorized so much by the electorate as healthcare issues, but they are very much front and center, I think, on people's minds.
I'm going to be the skeptic, the cynic here. No, it's not going to be a healthcare election. How am I? How am I doing? Do I feel like we're going in a positive direction? Am I concerned about the direction we're going in? Do I feel like things are in control, out of control? All of those more amorphous things. And I don't feel like that. I'm going to weigh in and say I don't think there's a lot of BBB that affects that, and certainly not a lot in BBB that will affect that in strong ways between November 8th, save for, of course, the APTCs, because that's taken away something from someone they already have.
Yeah, I mean, I do wonder if the pressure that was, there was, of course, over the summer before, I think, inflation and schools right now are a mess with the pandemic, and all these things were weighing much more heavily. I think when people were getting vaccinated and cases were going down and everyone thought we were going to have hot back summer, and then that, flew by the wayside. I do wonder, is it really going to be a referendum on COVID policies and school closures and trying to navigate this constantly changing, landscape? People are tired of what has been happening. But when it comes to healthcare, is there going to be the same kinds of political pressure to say, try to get millions of uninsured people covered, trying to lower drug prices, which of course, Democrats have been promising since 2006 in Congress. They ran in 2006 on this. And so is that still going to, I guess we have a long time until November, but, could it still kind of bubble up as an issue?
There's always room. I mean, for us to sit here on January the 14th and prognosticate as to how things will be on November 8th, hell, I'd have already retired from the money I'd have made on the sports books. Listen, I think it is, again, it's so much of the personal feel of how you are and how you feel like the direction is. The other thing I think we also need to remember is how incredibly polarized this country is. I mean, goodness knows we're all living in the sorting hat. If you are of one party and the odds are that it's a 60-40 county, meaning 60% for one party, 40 a landslide county. The odds are greater you live in one of those places than not in America right now. That's how sorted we are. And so we have to be careful that we're not representing our echo chambers and that we're only speaking of something that only represents where we are. Here, I'll give you this one. I bet Democrats win a lot of seats in California. I'll call that right now. Bet they do in the House of Representatives. But that doesn't necessarily spread out across the rest of America. And that's the thing that's hard for us to read. And I say this all the time. I work in Washington. I really want to hear from people from America.
Yeah, I mean, look, the world's an uncertain place. It's been even more so, obviously, since 2020, and it's not clear, exactly what happens in the voting booth or what could happen between now and November is a lifetime away in a political sense. So I think you're going to see a lot of, where we are this year relative to where we were, which is that, in terms of coverage, we've got nearly 14 million Americans covered under an ACA plan. You've got close to 5 million newly signed up for marketplace coverage. You've got 83 million who have coverage through Medicaid or CHIP. You've got close to 250 million who have at least one shot, and close to 76 million who've had at least one booster. I know, most importantly, my kids are in school. Most kids are in school. So, I think you could paint a picture, even though the world may feel chaotic, that is a much improved picture. And I don't agree that BBB would not make a difference. I know that there are not a lot of deliverables in the first year, but I think the idea that paid leave is coming, that universal pre-K is coming, that more childcare is coming, that we have taken a first step on climate change. I think delivering something like that, and even if people don't feel the impact immediately, the fact that those policy changes would be coming and would be pivotal to people, particularly middle-class people, being able to go to work and do their job and not worry about their health insurance and whether they can actually afford it and access it when needed. And the idea of, just being able to take care of those people stuck in those 12 states that have no avenue for coverage, I think does make a huge difference going into an election and affecting people's psyche in terms of how manageable their lives will be in the future.
And the overlay of that is that, my elected officials can get some things done, right? So which I think addresses some of the general malaise, even if they're not totally clear, and feeling the immediate benefits of Build Back Better.
Yeah, there was an interesting story from some of my former colleagues who cover Congress in Politico not too long ago, saying that in any other year, I think passing a massive, relief bill and a bipartisan infrastructure bill would be hailed as monumental achievements, legislatively to do. But because whether it's expectation setting or whether, they said these are the things we're going to do, and then Build Back Better has stalled out, and now voting rights is sort of on the vine also. People perceive it to be, that they haven't done things, but in reality, those two pieces of legislation alone are very significant to get done in such a short amount of time. But I guess expectation setting always matters, especially here. So I wonder if anyone else, Jennifer or Katie, do you want to weigh in on that at all anymore?
No, I think, I agree with what you said for sure. I think the other thing that we've all mentioned is November is a long time from now, and there's a very uncertain world out there. And, I think about like what's going on in Russia and what could potentially happen in other parts of the world. Like we're going to have curveballs between now and November. And that can definitely quickly change the calculus of what the voters are concerned about and worried about.
Right, I think that's the only certainty that we can be sure of at this time, right? That there will be at least half a dozen things that will come our way in the next 10 months that no one can really anticipate now. We just have about 5 minutes left, so I'm going to just quickly sort of ask you all, are there any final thoughts that you have from all of our panelists on this conversation? Anything top of mind that I did not ask you about or didn't come up from our audience questions?
Well, I could start. I mean, I think one of the areas in public health that I'm concerned about is the impact of this pandemic on vaccine confidence overall. I think that's an area that has not been partisan until now, and it has certainly become so. And so I'm concerned about the implications for public health writ large. And the other thing I would just say is bipartisanship is really hard right now. But I do believe that pandemic preparedness is one area where there can be bipartisanship. And my old boss, Senator Burr, said that your success in Congress depends on picking the right partner. And so I'm really hopeful that Senator Burr and Senator Murray have picked the right partners in each other, and that we are able to get something good done this year to make sure that we're never in this predicament again.
I'll jump in and mention a topic that we haven't talked about, which is kids. It's not really a topic, but they're just there's, as Yvette has identified, there's a number of really important things in Build Back Better with respect to kids. But what's really frightening is the impact that this pandemic has had on them, and both in terms of the material losses, but just the stress and the isolation and all the things that we know are going on with kids, and the crisis in mental health for youth and children. And there was a recent Surgeon General's report on it, and so I am hopeful that maybe there can be that bipartisan agreement that is being forged, at least in the Senate Finance Committee, around doing something on mental health, and particularly focusing on mental health supports for kids and youth.
I can go next. This is sort of a cross-cutting issue. I mean, this is a really big year for rulemaking. You know, if you think about sort of the timeline, there's this always counter pressure thing to maybe wait and see what happens with Congress, which, you know, maybe was a little bit happening last year too. But the rulemaking process sort of takes so long that to get things out this year that go into effect next year that then have some sticking and staying powder, assuming they're not struck or challenged in court, and then you have a executive record to run on in 2024. I think this is the year for rulemaking to really happen, and they've gotten started on that on some of the Affordable Care Act work. Medicare Advantage, they've put out some, and you know, they're leading with health equity. They're leading, I think, with some accountability measures, at least from the marketplace rules. They're pushing forward and asking for comment in a lot of different areas. But this would be this stuff just takes so long that if they want to get some things done, I think it would be a mistake to wait till 2023 to do some big rules, to sort of wait to lose Congress or wait to see what happens with Build Back Better before really turning to that in earnest. So I hope the Biden administration is quite ambitious within the constraints of the law, but quite ambitious on rulemaking. And I hope they turn to it pretty quickly here, or else you'll just run out of time, which is sad to think about, but it's sort of how this stuff works.
I know I had my turn, but I really want to second what Katie says. We tend to focus and did focus a lot on the Congress in this conversation, but the administration has a lot of authority and a lot of plans. And as you said earlier, Rachna, they've moved past the undoing of some of the things from the last administration, and I think they are really poised, whether it's through regulations as well as waivers, as well as CMMI initiatives, to really move forward and to see what they can accomplish.
Yvette, you want to go first? You want me to? Yes. A line I'm really fond of that I'm going to keep using here, which is biggest problem America has right now is the way we talk to each other. So I'd like to use this moment to say to my friends Yvette and Cindy how wonderful it is to be with you and have a civil conversation. And then I will also take a moment as a University of Georgia alum to express my well-earned insufferability. Go Dogs.
I was waiting for the hat to appear. I've never seen Rodney on a panel without a hat, so that was only a matter of time.
Well, this has been really great. I hope that I certainly got a lot of value out of it. I hope our audience still did as well. Thank you all for all your insights. We covered a lot of ground in just over an hour and a half. And just a couple of housekeeping things for our folks who listened in today. Please take the time to complete a brief evaluation survey that you are going to receive via email later today, as soon as this broadcast ends. And then the Alliance has the next briefing in this series is going to be on recent trends in coverage and affordability. That will be on January 21st in 1 week. And finally, a recording of this and materials will be available on its website. So thank you so much to Jennifer, Yvette, Katie, Sydney, and Rodney. It's been a joy to speak with you. So thanks for joining us.
Thank you.
Thanks.